Hello and welcome to North Bristol Trust. My name is Gina Ogard and I'm a midwife supporting our Women and Children's Services with our ongoing improvement plans in maternity and the introduction of what's called a National Maternity Transformation Programme, which is called Better Births. The actual vision of this programme was based on the findings of women's experiences in maternity care, how they felt, how they'd like to see things changed, and the overwhelming evidence that was gathered after talking to many women up and down the country was that women felt that they saw too many midwives, they saw too many doctors, they felt they didn't even know who they were, they didn't know what their role was, and women described how important it was for them to actually know who they were and how to form a close relationship with the professionals that were actually caring for them. And finally, they said that what they'd really like is to be cared for by just one midwife or just a small group of midwives. And they felt that this would enable midwives to better meet their needs and to identify the problems and provide a better service. Following this feedback from women, the vision and plan of the Better Births programme was designed so that most women will receive continuity of the person caring for them before they had their baby, during the birth of their baby and after the birth of their baby. And North Bristol Trust have now commenced putting this into practice. And there's some clips following which are from the thoughts and experiences of midwives that have set this up, who are working on this programme for our first continuity of carer teams to enable us to provide a better service for you and your families. Thank you.
Hi, I'm Victoria and this is Jo.
Hello.
And we're two of the midwives in Jade team based here at Cosham Birth Centre. Cosham currently offers a fantastic option as a place of birth for women across Bristol who are healthy and considered low risk for developing complications around birth. We have a team here who are passionate and they're committed to providing high quality care around birth, and we're really excited about expanding that now by forming a continuity of care team.
Jade's team will be able to care for women and their families here at Cosham Birth Centre all the way through their pregnancy, birth and the early days after their new baby is born. Each woman will have her own named midwife who will follow her throughout the pregnancy journey and work as a part of a small team to provide care during labour and birth. You will have the opportunity throughout your pregnancy to meet the other members of this team, so you can be cared for by the midwife you really know when you are giving birth.
Safety is paramount to us here, and we know that each woman's pregnancy and birth journey is unique, and we'll tailor your care to your individual needs, including involving other healthcare professionals or transferring your care to another setting if that's what's needed. And our team will make sure that you continue to be well supported during this time. If you'd like to know more about having your baby with us here at Cosham or having all your pregnancy and postnatal care with us here too, then please have a look for more information on our website or our MBT My Pregnancy app.
Hi, I'm Libby and I'm the team manager for the Lilac Midwives.
Hello, my name's Carly. I'm one of the Lilac Midwives.
We are one of the first teams from North Bristol NHS Trust to offer a new flexible model of care covering the Southmead, Henbury and Westbury-on-Trim areas. We're a small team of friendly and passionate midwives and maternity support workers who you'll get to know throughout your pregnancy journey. We're offering a mixed risk model, meaning that we follow you throughout your experience wherever you choose to give birth to your baby. This means that alongside your current antenatal checks in pregnancy, a familiar Lilac team midwife will be available every day and night to support you during your birth experience, and this support will continue in the early days with your new baby. This approach will help you to develop a trusting relationship with your named midwife. You will also get to know the supporting team members at antenatal classes, local community events and via telephone advice. Our aim is to ensure that all of our women and their families develop a strong and empowering relationship with their midwifery team to enable choices to be explored and improve satisfaction of your birthing experience. We strive to offer you safe, comfortable and high quality care across all of our birth settings, whether you choose to give birth at home, at one of our midwife-led units or the central delivery suite at Southmead Hospital. We want to reassure you that whatever your choice is, there will always be a friendly and familiar face or voice available to support and guide you throughout your journey with us. We will be clearly identifiable with our lilac coloured lanyards and coloured stickers on your handheld maternity notes.
Hi, my name's Carly. I'm one of the midwives from the Lilac team, and we're really looking forward to giving you better continuity of midwifery care in your pregnancy, when you give birth to your baby, and after your baby arrives. To begin your journey with us, we'll invite you to a booking appointment around 8 to 10 weeks of your pregnancy with one of the midwives from our team. This is an opportunity for your midwife to learn about your personal background, your circumstances, and to discuss a care pathway that's safe and appropriate for you and your baby. We'll always aim to offer you your follow-up appointments at the same clinic, on the same day of the week, and with the same midwife where possible. This continuity can improve the quality of care that we give you. And as you get to know your midwife, you might feel more confident and comfortable to discuss all aspects of your pregnancy, so that together you and your midwife can explore your options every step of the way. So in partnership, you and your midwife will work together to develop an agreed, personalised care plan, considering the needs of you and your baby. We work closely with our colleagues across all disciplines to accommodate your physical and emotional needs, and most importantly, your individual wishes. We'll be present during your labour and during the birth of your baby to care for you and your family, supporting you and empowering you to have a really positive experience. After your baby is born, we'll continue to give you consistent care with your known team of midwives through a combination of home visits and appointments at your local health centre. So we really look forward to welcoming you soon.